Depression, in its various forms, casts a long shadow. It affects millions across the globe, impacting their lives in profound ways. From the depths of major depressive disorder to the persistent weight of dysthymia, these conditions touch every aspect of an individual's being. Understanding these disorders is crucial for recognizing their impact and seeking appropriate help. Depressive disorders are not mere moments of sadness. They represent a disruption in the brain's delicate balance. This disruption manifests in a constellation of symptoms, including persistent sadness, loss of interest, changes in sleep and appetite, and feelings of worthlessness. These symptoms can linger for weeks, months, or even years, significantly impacting an individual's quality of life. It's important to remember that depression is not a sign of weakness. It's a real medical condition that requires understanding and treatment. By exploring the nuances of major depressive disorder, persistent depressive disorder, and premenstrual dysphoric disorder, we can begin to shed light on these often misunderstood conditions. This exploration will delve into the diagnostic criteria, associated features, risk factors, development, prevalence, differential diagnosis, and comorbidity of each disorder. This comprehensive approach aims to provide a clearer understanding of these conditions and emphasize the importance of seeking professional help. Major Depressive Disorder, or MDD, stands as one of the most prevalent mental health conditions worldwide. It's characterized by persistent and intense feelings of sadness, hopelessness, and despair. These feelings permeate every aspect of an individual's life, affecting their thoughts, emotions, behavior, and physical well-being. Diagnosing MDD involves identifying specific symptoms outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. These symptoms include depressed mood most of the day, nearly every day, marked loss of interest or pleasure in activities, significant weight loss or gain, insomnia or hypersomnia, fatigue, feelings of worthlessness or guilt, diminished ability to concentrate, and recurrent thoughts of death or suicide. The presence of at least 5 of these symptoms, including either depressed mood or loss of interest for a period of at least 2 weeks, suggests a diagnosis of MDD. However, it's crucial to remember that diagnosis is complex. Clinicians consider the severity and duration of symptoms, their impact on daily life, and the presence of other medical or mental health conditions. Beyond the core diagnostic criteria, MDD often presents with additional features. These can include anxiety, irritability, physical aches and pains, digestive problems, social withdrawal, and difficulty maintaining relationships. The multifaceted nature of MDD highlights the need for a comprehensive approach to diagnosis and treatment. Major depressive disorder is a complex condition influenced by a dynamic interplay of biological, genetic, environmental, and psychosocial factors. Unraveling these intricate connections is crucial for understanding the disorder's origins and developing effective treatment strategies. Research suggests that genetics play a significant role in MDD. Individuals with a family history of depression are at an increased risk of developing the condition. This genetic predisposition, however, doesn't guarantee the onset of MDD. It merely increases susceptibility in the presence of other contributing factors. Environmental factors such as childhood trauma, abuse, neglect, or significant life stressors can also contribute to the development of MDD. These experiences can disrupt the brain's delicate chemical balance, making individuals more vulnerable to depression. The prevalence of MDD is substantial, affecting millions worldwide. While it can occur at any age, the first episode typically emerges in late adolescence or early adulthood. Women are statistically more likely to experience MDD than men, possibly due to hormonal fluctuations and societal pressures. Differentiating MDD from other conditions with overlapping symptoms such as bipolar disorder, anxiety disorders, and adjustment disorder is crucial for accurate diagnosis and treatment. Comorbidity, the presence of 2 or more disorders simultaneously, is common in individuals with MDD. Anxiety disorders, substance use disorders and personality disorders frequently co-occur with MDD, further complicating diagnosis and treatment. Persistent depressive disorder, or PDD, formerly known as dysthymia, presents a different but equally challenging face of depression. Unlike the distinct episodes of major depression, PDD manifests as a chronic, low-grade depression that persists for at least 2 years. Imagine a pervasive grayness that colors everyday experiences, a constant weight that makes it difficult to experience joy or enthusiasm fully. Diagnosing PDD involves identifying a depressed mood that lasts most of the day, more days than not, for at least 2 years in adults or 1 year in children and adolescents. During this period, individuals must experience at least 2 of the following symptoms: poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, and feelings of hopelessness. It's important to note that while the symptoms of PDD may be less intense than those of MDD, their chronic nature can have a profound impact on an individual's life. The persistent sadness, low energy, and lack of motivation can seep into every aspect of their existence, making it difficult to work, maintain relationships, or simply enjoy life. Understanding PDD, causes and comparisons. The causes of persistent depressive disorder, like those of major depressive disorder, are multifaceted and complex. Genetic predisposition, imbalances in brain chemistry, and environmental factors all play a role in the development of this chronic condition. Individuals with a family history of depression, particularly PDD, are at an increased risk of developing the disorder. This suggests that genes involved in regulating mood and emotional responses may contribute to PDD vulnerability. Life stressors such as chronic illness, financial difficulties, relationship problems, or job loss can also trigger or exacerbate PDD. These stresses can disrupt the brain's delicate chemical balance, making individuals more susceptible to the persistent sadness and hopelessness that characterize the disorder. The prevalence of PDD is significant, though it's often underdiagnosed due to its subtle and chronic nature. Individuals with PDD may not even realize they have a treatable condition, attributing their symptoms to personality traits or life circumstances. Premenstrual Dysphoric Disorder, beyond the cycle. Premenstrual Dysphoric Disorder, or PMDD, represents a distinct and often debilitating form of premenstrual syndrome, commonly known as PMS. While PMS typically involves mild physical and emotional changes before menstruation, PMDD unleashes a torrent of severe emotional and psychological symptoms that can significantly disrupt a woman's life. Diagnosing PMDD involves identifying a cluster of specific symptoms that emerge in the week or 2 before menstruation, and typically improve within a few days after menstruation begins. These symptoms include marked affective lability, which means mood swings, irritability or anger, depressed mood, anxiety, decreased interest in usual activities, difficulty concentrating, lethargy, changes in appetite, sleep disturbances, feelings of being overwhelmed or out of control, and physical symptoms like breast tenderness, bloating, and muscle aches. To meet the diagnostic criteria for PMDD, a woman must experience at least 5 of these symptoms, with at least 1 symptom being from the first 4 listed in most menstrual cycles. These symptoms must be severe enough to interfere with work, social activities, or relationships. PMDD Unraveling the Complexities. The exact causes of premenstrual dysphoric disorder remain elusive, but research points to a complex interplay of hormonal fluctuations, brain chemistry imbalances, and genetic predisposition. The cyclical nature of PMDD strongly suggests a connection to hormonal changes associated with the menstrual cycle. Fluctuations in estrogen and progesterone, particularly the sharp decline in progesterone levels before menstruation, are believed to trigger the debilitating emotional and physical symptoms. Research also suggests that women with PMDD may have differences in brain chemistry, particularly in the way their brains process serotonin, a neurotransmitter involved in mood regulation. These differences may make them more sensitive to hormonal fluctuations, leading to the exaggerated emotional responses seen in PMDD. Genetic factors also appear to play a role in PMDD. Women with a family history of PMDD or other mood disorders are at an increased risk of developing the condition. This suggests that genes involved in regulating mood, hormone responses, and neurotransmitter activity may contribute to PMDD susceptibility. Seeking help, diagnosis, and treatment. Recognizing the signs and symptoms of depressive disorders is crucial for seeking timely and appropriate help. If you or someone you know experiences persistent sadness, hopelessness, loss of interest in activities, or other symptoms discussed in this essay, it's essential to consult a mental health professional. Diagnosis typically involves a comprehensive evaluation, including a physical examination, a review of medical and psychiatric history, and a clinical interview to assess symptoms. The mental health professional may use standardized questionnaires or rating scales to gather additional information about the nature and severity of symptoms. Treatment for depressive disorders typically involves a combination of psychotherapy, medication, and lifestyle changes. Psychotherapy, such as cognitive behavioral therapy or CBT, and interpersonal therapy or IPT, can help individuals identify and modify negative thought patterns and develop coping mechanisms for managing their condition. Medications, such as antidepressants, can help correct chemical imbalances in the brain that contribute to depression. Selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, are commonly prescribed antidepressants for depressive disorders. Lifestyle changes such as regular exercise, a balanced diet, adequate sleep, stress reduction techniques, and social support can also play a significant role in managing depressive disorders. These changes can improve mood, reduce stress, and enhance overall well-being, complementing professional treatment. A final word: hope and healing. Living with a depressive disorder can be incredibly challenging, but it's essential to remember that hope and healing are possible. With proper diagnosis, treatment, and support, individuals can manage their symptoms, improve their quality of life, and live full and meaningful lives. Remember, seeking help is a sign of strength, not weakness. Reaching out to a mental health professional is the first step towards understanding your condition and beginning your journey towards recovery. By increasing awareness about depressive disorders, challenging stigma, and promoting access to quality mental health care, we can create a more supportive and understanding environment for individuals living with these conditions. If you found this video insightful and want to keep exploring the fascinating world of psychology, don't forget to hit that subscribe button. And to make sure you never miss out on our latest deep dives into the mind, tap the bell icon to get notified instantly. Together, let's continue unraveling the mysteries of the brain and mental well-being. And hey, if you enjoyed this, give it a thumbs up and share it with someone who might benefit from it. Thanks for watching, and see you in the next one.